A teratogen is really just anything that can expose the baby to health complications, birth defects. Not all teratogens can be avoided, certainly. I think the most common ones that we think of would be alcohol, drugs, things like that. Some of them, particularly ones that can't be afforded, you're looking at pollution, certain things in the food that you consume, um, lead paint if you're in an old building. There's really a lot of things. Um, I think sushi is one. You're just not supposed to eat fish. There's so many things that would be considered a teratogen. Um, Structural abnormalities do tend to be obvious at birth. Sometimes you see that, particularly with um, alcohol poisoning. The child can develop fetal alcohol syndrome, and then they have physical structural abnormalities when they're born. Genetic vulnerability is a particular example of differential sensitivity. Um, Genetic protections or hazards are suspected for many birth defects. Low birth weight has increasingly become a problem in the US. About 8% of newborns are seriously underweight, which doesn't sound like a lot as a percentage, but if you think of that in numbers, it can get quite high. Um, Babies in the US are more susceptible to teratogen, so there are higher birth risks. So some of the things that cause low birth weight are listed here: maternal health and illness, that's physical health, that's mental health, drug use before and during pregnancy, malnutrition while the mother's pregnant, father attitudes and behaviors. Immigrant paradox is just this discovery that um, it, low SES typically correlates with poor health, although that's not true for Hispanic parents in the United States. So if you compare with the US average low birth weight, Hispanic newborn babies are less often of low birth weight. I think it's important to remember this little thing at the bottom. The risk analysis gives odds, not certainties. Just because kids who are high risk or of low birth weight, um, maybe they hit their developmental marks late, and but that's not guaranteed. They also, may they cry more, pay attention less. All these things are not certainties. This may happen for the typical child who was born of a low birth weight, but it's not necessarily like a given. Certainly, other environmental things can shift their development. This is an interesting image of food insecurity here in the U.S. You can see when the recession hit, kind of 2007, we kind of really tanked down, and all family types were affected. Single fathers were most likely to lose their jobs and not know how to get food stamps. Um, Children of single mothers are hungry more often than children of single fathers, and 3 times as often as children of married parents. This data certainly shows correlation, but it's certainly not a causation. We're not sure exactly what the causes are of food insecurity and low birth weight. The APGAR scale is just this quick assessment of a newborn's body functioning. So, when the APGAR scale, I think, is named after a nurse. Her name was, I believe, Victoria APGAR. She was noticing that there was a lot of deaths when the baby was born, and she couldn't figure out why. She realized it's because The doctors were busy focusing on the mother and getting her fixed up so she would live, and then they kind of just let the baby off to the side. So um, this nurse, realized, wait a second, we need to make this quick assessment of the newborn's heart rate, breathing, muscle tone, color, and reflexes. Needs, make sure the baby is doing well. The ideal score here is 10. Obviously, that would be perfect score. That's rarely attained. So really, they're hoping for at least a 7 in out of all of these categories. And they do the test twice, at 1 minute and 5 minutes after birth, just to kind of make sure the baby's pinking up and is responding, and so to make sure the baby's healthy.